Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Hello everyone, I'm Alex, physical therapist assistant.
I'm Mike, physical therapist assistant.
And this is the Total Hip Replacement Fitness Program. Exercises 0 to 1 week or immediately after your surgery.
I gotta uncross my legs. I'm already breaking precautions from our old video.
That's right, way to pay attention. There's 4 goals in this phase. I'll start. Number 1 is very important, pain control. You're probably gonna have some pain after surgery. You're gonna need to take care of that pain with, number 1, medication. Your doctor or your surgeon will prescribe you some medication to get through the first few weeks. And then also deep breathing. In through the nose, smell the roses, out through the mouth, blow out the candle.
Try to control it.
Yep.
Inhale for 3 to 5 seconds. Exhale for however long you feel comfortable with.
Yep.
On to number 2 is swelling management. So RICE is a common thing here. Rest, ice, compression, elevation.
Yep.
It helps decrease your risk of any blood clots forming. And also it's good to monitor your incision. Just make sure there's no infections there. I mean, you're going to have a little warmth and swelling more than likely.
Because there's blood flow, yeah.
Yeah, but just keep an eye on it. If you're worried, just call your doctor, but most of the time it's fine.
Yep, and use that ice as you need to. That'll push some of the swelling out.
Yeah.
Number 3, follow your precautions. We posted a video probably a couple days ago now about your precautions depending on what approach you might have had surgery. So if you have anterior precautions, posterior precautions, or your surgeon might have other precautions for you, follow those before you follow, what we're telling you here.
And the last goal for this video is this is the beginner range of motion exercises and strengthening as well. So nothing too hard. It's just kind of get moving and get a little strength and help decrease that swelling.
Yep.
And help heal it.
I want to go back to precautions for a second. We don't want you to dislocate your hip. That's why these precautions are in place. I should have said that. Sorry. All right. Let's get into the exercises. A lot of these are going to be laying down, but then we'll eventually move to a chair. So we're going to start.
Ankle pumps.
Ankle pumps. I'll do them sitting right here. Do you want to lay down yet? You're going to get there anyway.
I'm getting tired. I better rest for a while.
All right.
All right, I'm going to do them laying down. Alex is going to do them there. Do I need 2 pillows? Why not?
Yeah, you do.
Luxurious life with 2 pillows.
So I'm doing ankle pumps, almost like calf and toe raises here seated, but
I'm doing them as well. Just
no different.
Work on getting some fluid moving throughout your legs. Very basic, easy to do in bed when you wake up and go to bed at night.
Yep, and you could even elevate your legs on a bolster or a bunch of pillows, and do ankle pumps like that.
The second exercise is glute sets. We recommend 10 sets. 10 reps.
10
Sorry.
reps. 10 sets. Holy buckets, he's got a
10 reps with 5-second holds. So squeezing my butt cheeks together.
Yep.
2, 3.
We're doing it
4,
right now,
5.
but you can't see
Relax. Go again. 1, 2, 3, 4, 5.
This is how I stay warm when I'm out hunting. White-tailed deer. I do glute sets.
They could probably hear you squeezing your butt cheeks.
They probably can.
You don't grunt when you do it.
No, I try not to.
Oh, okay.
All right, so we're squeezing our butt cheeks together. Number 3 is quad sets. Mike's going to demonstrate here.
So this one, just kind of push your knee into the mat a little bit.
Yep.
So I'm holding down.
Tighten your quad and push it down. Try to straighten your leg out as much as possible.
Same as last time, 10 reps, 5-second holds. I guess you can count Mississippi's or 1000s or whatever you... What else can you count? I don't know.
Anything. All right, Wisconsin's. That's where I'm from. All right, and then we're going to do supine, which just means laying on your back, hip, abduction, adduction, which just means your leg in and out.
I'm going to move over because our plinth is really small, not like a normal bed.
And I'm going to give Mike a towel there, or you could use the Bob and Brad knee glide, but most will probably have a towel.
So all you're going to do is go out to the side, and I'm limited by my bed,
Yep.
and come back in.
Back in. Yep.
You typically want to have your leg on the mat yet, especially early on. This would actually be easier if I was in socks, to be honest.
Yep.
But
So-
you're just going side to side. Don't worry about lifting up yet and going out. You're probably
You'll
too
get there.
weak for that.
Yep.
So.
Yep. If Mike had a sock on, like he said, he'd probably go, in and out just fine. There he goes.
Weird.
What he does for the viewers. Now we're gonna do heel slides. He's gonna slide his heel towards his butt.
So I'm going to leave this one bent,
Mm-hmm.
and then I'm just going to work on sliding
Yep.
towards my butt and then down. Don't go like too high. You don't want to break your precautions.
Yep.
Remember, no bending beyond 90 if you have a posterior approach.
Yep. And show him, Mike. You might not be able to go that high. You might just have to go about there
Just go here.
and back down.
If you feel pain in your hip, obviously if you have a bad knee, it's going to be a little different, but just go what your hip allows right now.
Yep. And you could use a towel or the Bob and Brad knee glide works well here as well. So
And for these exercises, you can do 10 reps as well. You don't have to hold it at all like the other
Yep.
ones. Just kind of go back
Yep.
and forth.
start with 10 reps. If you feel like that was no problem, then increase from there.
And these exercises, you don't have to do them all at once. You can do them throughout the day. Figure
Right.
out what time of day works best for you.
Yep. Match them up. Take your pain meds about an hour prior. Usually works pretty well for people. So, all right, you've exercised enough. You're sweating.
Oh, I am?
We're going to switch to doing some. Well, no, let's have you do one more. Take one of your pillows.
But I'm sweating.
I almost forgot one.
You did. Short
You're going to
arc.
have to go
All right,
work through it, Mike.
We're going to do short arc quads. So smash a pillow in there.
Don't break your precautions by going up like
No
that.
one saw that.
All right.
Okay, so all I'm going to do is kick up.
Hold it.
And back down.
The key is to try to go ahead, straight line from his hip to his knee to his ankle.
If you're able to hold these for 5 seconds, go ahead and do that. If you're not, 3
Yep.
seconds would be fine. If
And
you're
come-
too painful.
Come down slowly because it's still strengthening. Eccentric strengthening as you're coming down. Eccentric, you knew what that meant, didn't you?
Yep.
Yeah, piece of. All right, and then we're gonna go to a seated position. We can't do all exercises laying down, so
Why not?
I'm gonna cause you can't
Okay.
rest all the time. Number 7, floor scrubs. Now I'm gonna use the Bob and Brad knee glide here, and I'm gonna have it flat just because I don't wanna. If I had posterior hip precautions, I don't wanna break the 90-degree angle, and I'm even gonna sit up straight so I'm not breaking the 90-degree angle, and I'm just gonna get the knee and hip moving a little bit here.
This is very similar to the heel slides in the laying down position.
Yep.
But yeah, this one's definitely easier to do with the knee glide if you have one.
Yep.
Again, you can use a towel if you do not.
Yep.
Or socks on carpet, I guess.
And then number 8, let's say this is probably the most important one, right?
Yeah.
Getting up and just walking. You're probably going to be using an assistive device, walker,
You're more
crutch.
than most people at this time are on a walker. Someone might be on a crutch or a cane, but it's not very common.
Yep.
So don't feel bad if you're not. But yeah, just get up and move around numerous times throughout the day. Don't go out and walk a bunch, like walk a mile right away. Just go on short little walks for a few minutes.
And your quality might not be, very pretty, but, that'll get better as the weeks go on. So.
Yep.
All right, I think that's it.
That's it. Check out all the other videos related to Total Hip Replacement Fitness Program. You can go to bobandbrad.com/programs.
Thank you.